Study time, physiological adaptations of pregnancy. The uterus. The uterus contains 3 layers, the endometrium, myometrium, and perimetrium, starting from inner to outer layers. It starts small, growing from the symphysis pubis and upwards. Behind the pubic bone, 8 weeks. Reaches umbilicus at 20 weeks and almost reaches the xiphoid process by the end of pregnancy and goes from weighing 50 grams to 1,000 grams. The cervix is the lower uterine segment, opening. Vagina is the birth canal. We have abdominal wall, skin, and breasts, which all can darken. The linea nigra is the belly line, the cloasma is the butterfly mask, and the areola darkens and breast grows. So 8 to 12 lobes, each contains fat, 20 to 40 glandular lobes, 10 to 100 alveoli, and 5 to 9 ducts that branch out from the nipple. The striae gravidarum is the pink silvery stretch marks. And for musculoskeletal changes, relaxin causes increased joint mobility. Weight gain is about 1.5 liters or 2.1 quarts due to blood volume increase to supply the placenta with nutrients and oxygen. Weight gain increases during the pregnancy. Baby, uterus, placenta, blood volume, adipose tissue stores, etc. Is lost during the birth, baby, placenta, blood loss, and later on, decidua and lochia, and is gained within the first few days postpartum before returning to baseline weight levels over the next few months or weeks. Nutrient needs increase as well as hydration, pH becomes more acidic, mineral levels dip resulting in increased absorption rates. Blood volume increases 30 to 60% with pregnancy due to blood pressure falling before plasma volume expands, called angiogenesis, and is at peak volume right around 28 to 30 weeks. Leukocytes increase. Clotting factors that enable coagulation include but are not limited to fibrinogen and factors 7, 8, and 10. 2 and 5 remain fairly constant. And its concentration increases 50% after 12 weeks gestation to 200 times the pre-pregnant state. Cardiovascular, stroke volume times heart rate, a way to measure how much blood the heart is pumping at a given point in time. Cardiac output increases 10 to 15% during pregnancy, 30 to 45% above non-pregnant levels by 20 weeks. Stroke volume increases by 10% during pregnancy. A little redundant there. Heart rate increases 10 to 20 beats per minute in pregnancy. Blood pressure dips mid-pregnancy and returns to normal. Pregnancy glow is from blood being brought closer to the skin surface to cool the body. Lungs. 16 to 20%, which is about 45 milliliters a minute, increased need for oxygen during pregnancy, normally 220 milliliters per minute. With pregnancy is 225 milliliters per minute. 1/3 of the increase is due to the fetal and placental needs. PCO2 remain fairly constant. Breaths deepen, not quicken, to inhale more air during pregnancy, from 500 to 700 milliliters. Diaphragm also gets displaced in later pregnancy due to increasing uterine size, reducing expansion capacity, and increasing the likelihood of breathlessness at times during the 3rd trimester in particular. Bladder. During pregnancy, baby can displace the uterus when relatively full bladder. During pregnancy, the bladder can displace the uterus when relatively full for long periods of time, and risk of UTIs are increased due to the increased needs of urination during pregnancy. 6 to 12 weeks is when the uterus is lifted out of the pelvis, and compression of the ureters eases just a little bit after that first trimester, and then you'll feel more pressure in the last trimester again. Renal GI function. Gastric emptying is delayed due to reduced motility and tone, but returns to normal within 6 weeks postpartum. Organs. Liver creates albumin for the blood, increased need during pregnancy, and clears the bloodstream of hormones, about 100 birth control pills a day, removes toxins, and the gallbladder creates bile, which is essential for fat metabolism. Can have stones and be asymptomatic until aggravated by pregnancy. Would experience sharp pain after fatty cholesterol-ish meals on the right upper quadrant or shoulder areas. Murphy's sign includes breath stopping during right upper quadrant, right side palpation. And lastly, endocrine glands, enlarged to keep up with increased needs. Blessings to you on your midwifery journey.